Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello and welcome to today's webinar. My name is Annie. I'm a clinician and a product manager here at Axxess. Today, I will be talking to you about the clinician workflow within the AgencyCore platform. So this is a view of the AgencyCore Axxess Planner. So what we see here is the Axxess Planner. And so today I'm going to briefly talk to you about the Axxess Planner. So if you have logins to multiple agencies within AgencyCore, or if you have multiple logins to other products like the home care or hospice, then you will see this Axxess Planner where you can access multiple agencies by going to the different agencies within one screen. And this is mainly created so that there'll be ease of use. We are not logging in and out of different agencies and having to remember different logins. So here in the Axxess Planner, like I said, the AgencyCore, all the agencies that is listed within or that you have login within AgencyCore is listed on your left side, and along with any other products that you have access to. Like for example, if you have access to home care, then you would also see that in this section on the left hand side. So on the top, you have your date range, the weather report, so that you can plan your day. So suppose I have a visit for tomorrow, and if I see that there's going to be ice storm or sleet, then if I could change move my visit, then based on the agency policy and by letting the agency know, I could move it to another day. So this helps me with that. So here we see today's visit that's scheduled. I see a skill visit note, I see the patient's name and the date and the time of the date of the visit, as well as the agency's name will be seen here. And the same visit is correlated here, which shows me today's map with my location, which is in green, and the patient's location, which is in red. Okay, so if I use these buttons, the forward button, the backward button, I could go to the other dates and I could see the visit that were posted that day. On the right hand side, you will see the unread messages, and remember that since this is an Axxess Planner, meaning to say it's an overview of all the agencies that you have access to. So these are unread messages from different agencies. So pretty much if I click on any one of these, I will be taken to that particular agency. And right at the bottom here, we have past due visits. And these are visits that I have not documented on. And so the oldest visit will be on the top. Okay. And I could sort this the way I want it. Here on the right hand side, you will see alerts, and alerts are notes that have probably been sent back to me. So in this case, you can see it was returned for review. The date of the visit is there, and just for privacy purposes, I have blocked out the names of the agencies. So there are two notes. One was probably a resumption of care, and the other one is of the plan of care associated with that. Both have been returned by this one particular agency. So this alerts me to the fact that, hey, there's some returned visits. You may want to take care of that ASAP. So again, the Axxess Planner is an overview of every visit and every event that happens on a particular day. Okay, so now let's go to a particular agency. I'm going to log into the Beta Advanced Testing Home Health Agency. And here I am. Okay, now that I am in the Beta Advanced Testing Home Health Agency, so now this is my dashboard for this particular agency. Okay, so let's go over the different information that you would see on your dashboard based on the permissions that you have been given. So everything is permission based. So you may see some things on my screen that probably you may not have on your screen if you are not having the permission for that particular information. Okay, so on the top left, you see the video. So any videos that have been released by Axxess or that is currently being played by Axxess is what you will see on your left-hand side. And in the middle, you have your time, your date and time, and then day, date, and time actually. And then you have your messages on the right. Now these are messages specific to this particular agency, which is Beta Advanced Testing in Home Health. So I could go to this blue link to access my inbox, or I could go and compose a message by clicking on this link. And on the bottom here, you have news and updates. So any news, any latest information, especially in the industry, will be displayed here. You could click on it and actually read through that. Just wanted to highlight something. So most of these tiles that you see on this page has this word more. So if I click on more, I will get a full screen of this section, which is news and updates, and I'll have multiple other news that I could read. Okay, so in the middle, we have my scheduled tasks, which gives me a list of all the patients that are scheduled under my name and what are their functions that I have to be doing for them. It's a skill visit note. In this case here, it is an OSS D1 follow-up, and those have been scheduled on these particular dates. Again, this is a testing environment, so you will see dates that as far as October 3rd, and this is only for testing purposes. And on the right hand here, you have patient birthdays. So the birthdays that are especially upcoming are will be seen for the month actually, and the patient's name and how old they will be and their phone number. So this helps us because if you're seeing this particular patient and you would like to wish them, for their birthday, that will be a great way so that you do not forget and you are reminded as to their date that their birthday falls. Okay, so going down, you have the past due research. Again, these are research that have been assigned to me, and these were the dates. So I can go here and directly, if it's already done, if I've already seen the patient, all I got to do is click on the link, and this will take me to that particular patient's chart. Here in the middle, you have upcoming research, and here again, you have the patient's names and when they are due. Okay. Right here again, you have outstanding claims. So now remember, like I said, if these are all permission based, and so if you do not have the permission to see outstanding claims, then you will not have this information on your dashboard. And like I said, all of these sections or tiles has this little word called more, and when you click on that, you will see more information about that section. Okay, so now I just wanted to highlight real quick here on this My Scheduled Task. So if you see My Scheduled Task, and if you click on the more, you see this section open up, and it gives me all the patients that have been scheduled under my name, the type of task that's assigned to me, the dates that they were assigned, and the status of it. So these two, you see, they have been saved versus these have not even been started. So the ones that have not been started and the ones that have been saved, you will see a missed visit form link also there. The reason is because if for some reason that visit was not performed, meaning to say I were called the patient or the family and they refuse a visit, or they had gone to the hospital, whatever be the case, you can click on this missed visit form and complete a missed visit for that particular day. Now, if the patient was posted in AxxessCare, you will see a little heart sign. When you see the heart, you know that this visit was posted in AxxessCare. So the missed visit form is not given in those particular kind of visits, because if it's an AxxessCare visit, they want you to send it back to the agency so that the agency can decide if that was supposed to be a missed visit, or maybe they will try to send another clinician the rest of the Medicare week to complete that visit. Okay, so let's click out of there. And now I just wanted to show you, the different tabs on the top. So you see the different tabs. It says Home, Create, View, Patient, schedule, access care, billing, PDGM, admin, reports, and help. So just again want to bring to your attention that like billing and admin will be only given to the people who are managing those functions. So if you are a clinician on the field, there's a good chance that the billing and admin tabs won't be visible for you. And similarly are the reports. Sometimes even reports are not given to clinicians on the field. Okay, but so here let's go to each tab. So if you hover over the home tab, you see my accounts, my dashboard, my messages, schedule tasks, monthly calendar, pending course signature, notes, QA, quality assurance center, and EVV exception center. So most of these again are based on permissions, but anytime you see something and you have a little arrow mark here, let me put my cursor down. So here if you see there's a little arrow mark here on the my account, so that means there is more to it. So you see you could edit your profile, you can reset your signature, or you can switch from agency to agency, or you can switch to home care or the other products that you have. So resetting your signature is very easy now, so because you can manage it yourself. Okay, when you click on this, you will be given a link, and once you put your email, a link will be sent to you, and you can follow the instructions on that. Okay, now going to the next one, which is your create tab. So the create tab has new and OSS export. So under new, what it means is anything that you want to create new this is how you go about doing it. So you want to create a new referral, you want to create a new patient directly without going through the referral process. You want to click and add a patient. If you want to add a new episode, compose message, any of these functions listed, you will be able to create by clicking on the appropriate tab. So you can also see that you can create an incident or accident log, and you also can do an infection log by clicking on this button. Okay, the next one is view. View is actually you're viewing anything that's already been created. So it says view lists, and all the same things all of those tabs that you saw under create is going to be seen under view list. If you see here, patients, referrals, contacts, everything that you have created for your agency, you will find it here, including the incident logs, infection logs, communication notes, and immunization logs. Also, this particular tab has blank forms, exported OSS, past due research. You can view the same that you have found in the this particular tab or this particular section. You can find under this particular tab too. Upcoming research, orders management. Under orders management, you will be able to view the orders pending co-signature, orders that need to be sent to the physician, and that's pending MD signature, and also go and access the orders history. Okay, next you see under patients, you can go directly to the patient's chart. So under patients charts, you will be able to view all the patients that are in the system. And then you can go to existing referrals. For example, if you have created a referral and still waiting on the patient to be admitted, you could go to to this particular section, which is existing referrals, and admit the patient from there. Okay, then you have pending admissions, non-admissions list. If you want to view that, you can go to deleted patients, hospital logs, and the pre-claim review center. Okay, the next tab shows you schedule. So anything to do with schedule, my schedule task, my pending co-signature notes, schedule unassigned visits, and this is again permission based. Okay, schedule center, reassign schedule, schedule report, and schedule deviation reports. And again, many things are permission based. I'm just reiterating that because you may wonder why you're not able to see these particular things on your dashboard, and that is the reason why. Okay, so you have access care here, and again, access care is also, this particular section is for the agency, especially agencies that have that are in those states that have the access care already implemented. So those states can switch to the access care dashboard. They can also go to the access care scheduler, or see a summary of the posted visits. Now we're going to bypass billing and we're going to bypass admin, because like we said, this is not mainly one of those functions that will be viewed by, or can be actually seen by the clinician on the field. So let's go to PDGM. The PDGM is a new tab, and it is a wonderful tab which gives you the PDGM center, the billing center, which is a new billing center. We have the PDGM modeling tool, a resource center, and revenue impact analysis. Again, here we have, if you click on the PDGM center, I'm just going to quickly show you here. The PDGM center is coming January 1st, 2020, because that's when PDGM is going to be effective. And here from this center, you can go to the PDGM billing center, revenue impact analysis, PDGM modeling tool, or the resource center. This is one stop where you could get all the information regarding PDGM. Okay, so while we are here, let's look at the PDGM modeling tool. So when we look at the PDGM modeling tool, I'm going to click on this to show you something real quick. This is a PDGM modeling tool. It's a cool tool where you can actually put in information and use it, so that if there's a patient that's coming up, a new referral, you could actually add their information in based on what you know, and it will tell you what clinical grouping this patient will most likely fall. So in this case, I have put an example of hypertension with CHF. So I have put the code here. It's falling under MMTA, cardiac and circulatory, and you have the CHF code here. Okay, and then if I scroll down, I can just, I'm assuming that this patient is probably a medium functional impairment, because I am only, this is an assumption because all the other information comes from the OASIS, right? So if I put medium, then it would show that the first 30 days, this will be the case mix, your LUPA threshold, there's a possibility that it will be 2. Your potential amount to be received in the first 30 days is this much, versus the second 30 days is this much. So it's a tool where you can actually, plug in your information and get an idea what kind of revenue this patient will be bringing in. Okay, I'm going to come out of that. Okay, so that's a PDGM center. So we also have the PDGM resource center, that it takes you here to our software, where you can actually look through the different blogs and the webinars, the whole lot of information that we have given in here for the PDGM tools for success. So if you see, there's a whole lot of information that you can read and understand, and a lot of on-demand videos that we have. We also have blogs written, and this will help you to increase your knowledge on PDGM, especially because Axxess is a thought leader. So we have put in so much of information that you can get yourself readied for PDGM. Okay, so let's go back to the center here. So we have the PDGM center, which I told you, it gives you an overview of all the different PDGM updates that we have made in the system. We have the new billing center here, the modeling tool, which I just now showed you. Then we also have the resource center and the revenue impact analysis. Again, this is permission based. Okay, let's go to the reports. So reports, under reports, we have report center, we completed reports, and EVV exception center. So under report center, I'm just going to show you real quick. We have multiple reports. Again, this is also permission based. So based on what permissions you have, you will be able to see this. I just wanted to quickly highlight that whatever tab or the section you're going to look at, if you just hover over it, you will see a description of that particular report, the parameters for it, and the report, what all does the report include. So it's a cool way so that you don't keep clicking on it and having to find out. But if you just hover over it, you will see the description, the parameters, and what other information that's going to be there in that particular report. Okay, so let's come off that. The last tab on the top toolbar is your help. And help gives you access to the social media. It gives you access to ICD-10 code lookup. And it's a cool thing because if you click on this, you can type the description of your code, and you will be able to look at the different codes that are available. We also have live training webinars. So if you can check this out, because that will help you to to see what other new webinars are upcoming, that it will help you to be on top of the latest updates, especially regarding PDGM. Then you have support and training, where it's about community and help center. Help center is a great place for you to go and check out the different resources that's there regarding the different features that has been made within the system. And then the last one is the recent software updates. So if you click on this, you will be taken to the page where different updates are that you whatever has been updated within the system, you can see an overview of that. And in fact, not just an overview, in fact, in-depth information as to how to access it. Okay, so let's go back to our system here. Okay, so now here again, you will see the video on the left side, your date, day, and time. Then you have your messages. Now these messages are particular to this particular agency. Okay, if I click on inbox, I can go directly to all everything that's in my inbox. Versus if I go on compose message, I can compose a message to send it to different people within my agency. And this is HIPAA compliant and secure. Okay, so the next tile is your news and update. Again, similar to what you saw in the Axxess Planner. You have my scheduled tasks. Okay, you have patient birthdays, upcoming research, outstanding claims, which we went over earlier. Okay, then now let me also show you. So now that we have gone over the overview of the dashboard within this particular agency, I'm going to go over to one particular patient, and let's see how to document within Axxess. So I went to patient's chart, and my patient's name is Damien. So I'm going to go to Damien Bailey. And okay, so let's talk about the patient's chart. So in the patient's chart, you have, okay, this is the patient chart. I have the patient's name, and I have a way to change the photo or add new photograph. The medical record number is here. His birth date is here. The start of care, when his, the new episode started. His mobile number, physician's name, insurance name. So now you can see this particular here section, it says edit. Now if you don't have the permission to edit the patient profile, you will not see these buttons. Okay, so in my case, I'm able to see. So if I want to edit any particular information of within the patient profile, all I got to do is click edit and change the information. And the same here, if I click on directions, I will get the directions to go to this particular patient's home from where I stand. And here also you have admission periods. If I click on this, I will be given the information about the different admission periods that this patient had. Okay, next we have here refresh and change status. Again, refresh is refreshing the page. Change status is now this patient is active, and if I want to make this patient a discharge, if I click on change status, I will be able to discharge the patient. You can also see that this patient has been is having the risk stratification of DNR posted here, and this has emerged because it's the trigger factor is in the OASIS. So in the OASIS under advanced directives, when I say that this patient has DNR, then this particular verbiage comes up so that anytime anyone is looking at the chart, they know that this patient is a DNR. Okay, on the right hand side, you can see quick reports for this patient. So you have multiple quick reports. So this is a quick overview of the patient's profile. So if I click on patient profile, I get all the information on this particular patient. Okay, and this can be printed. Let me scroll down. So you see everything is here, including the emergency preparedness, referral date, all this information is here. Okay, then you have allergy profile, and the next you have medication profile. So when you click on medication profile, I just want to show you real quick something. So here is the medication profile for this patient. It has the episode date, allergies, what's the primary diagnosis, what's the secondary diagnosis. So you can add a medication by clicking on this tab. I can sign, I can print. But what I wanted to highlight is anytime I'm getting ready to sign a profile, the system asks me, did I do a drug interaction? It makes you do a drug interaction. So what happens is when you do a drug interaction, the report is printed right there, which you can use to educate your patient. Okay, and then here you have all the signed medication profiles for this particular patient. Okay. Next, we have the immunization profile, authorization listings. Again, authorization listings, if you don't have permission, you won't see this. Communication notes, all the communication notes for this particular patient. So if I click on it, it is based on the episode. So if I want to go to a different episode, all I got to do is pick that particular episode and I can see the communication for that episode. It also helps me to I can also add a new communication note from the screen, or I can export it to Excel. Okay, then we have orders and care plans. If I click on this, it gives me the different orders for this particular episode, and these are all that's in there in the system already. Okay, and then we have the plan of care summary. The plan of care summary is the evolving plan of care, and it's again episode based. So for this episode, there is nothing. So if I go to the previous episode, you see the orders and the discontinued orders. So if it's current orders, you will find frequency and duration, all the changes and when it was made. Then you will see medication orders. So if there's any changes that happen after a plan of care is created, it will capture that particular change here. Okay, then we have SN orders, which is your interventions. Okay, and this will capture the date, the time frame that the change happened, and who did the change. Okay, and I can always print this particular note. So the plan of care summary again is the evolving plan of care, because as orders change within the time frame, which is your episode, that particular order gets captured in this section in the plan of care summary. Okay, and here you have episode summaries. Let's take a look at that. Episode summaries. So here between this range, we don't have any episode summary. So I'm going to the previous episode, and you can see there's a intra episode summary that has been auto generated. Okay, the clinician's name, the date, the signature, which episode, and the physician's name. I can also print this, and I just wanted to, and if I think that this particular episode summary was not correct, or if there's more updates, I can delete it and create another. So when you create an episode summary, it will capture information as of this time. Okay, let's close that. I also wanted to say one thing real quick. Let me reopen that. See, you see this learn more and watch. So wherever you see this learn more and watch, it gives you more information about this particular feature. Okay, so if you click on learn more, it will give you a write-up about this feature, and this watch will give you a little small video clip about this particular aspect of feature. Okay, then we have the vital signs chart. So if I go to the vital signs chart, it will give me the patient's name, the graph, and the vital signs that has been logged in the system. So if I want to have a particular date range, all I got to do is go to the vital signs log, and then I can correct the date range. For example, if it was from the 24th through the 26th was my time frame that I wanted, all I go to refresh the screen, and it will give me a quick overview of what the blood pressure ranges were, what was the temperature, pulse, respirations, etc. And if I want to, I can also export it to Excel. Okay. The next one we have is the triage classification. So when we click on the triage classification, okay, the triage classification is, here in this case it says emergency contact was Christopher. The contact number is that's the number for the triage. Let me pull this down here. Okay, and here we have the triage. So what's marked here in the system, let me pull this down. So in this case, the triage level is 3, and what the explanation of the 3 is also given. And the last on this quick reports is your deleted tasks. So the deleted tasks will give you all the tasks that have been deleted within the system. So for example, you documented on a particular skill visit note, and for whatever reason the agency decides to delete that particular note, that note really goes off from this view, but it will sit down here. So that way nothing is really lost. So if you click on it, there are multiple notes that have been deleted. So if you decide to that, oh, I did it by mistake, I need that visit note back, all you got to do is click restore, and it will put the note back in its place. Okay. The other aspect of this patient's chart. So let me go quickly here to show you. See on the right, since I picked this patient, it's here. But if I needed a discharge patient, all I got to do is click on the view discharge patient, and it will take me to the discharge patients list. Similarly for pending patients or non-admitted patients. So in the chart, suppose I wanted to add a new order. Okay, all I got to do is go to new, and you see I can add a new order, or I can ask for a new authorization. I can create a new aid care plan, or I can do a communication note, a new communication note. So let's go to a new order. So if you go to a new order, so I clicked on new order. So our new order has the patient's name. I need to fill this as to which episode am I talking about. So in this case, suppose I'm taking this episode, okay, for 12/19. The physician's name is pre-populated. I can send copies to another physician if I want to, but just wanted to say that even though it says copy to, the system automatically does not send the this particular copy of this order to this physician. It's only so that in the note, the print view, it will show that this note was sent to this particular physician. You will ideally have to manually fax it to the physician. Okay, and here you have the date. You need to record your time and effective date, which day is this order effective, and is this order for the next episode. If it is, you have to just check mark this. Okay, so down when you go here, you put a summary on the title. Is it a resumption of care order? Is it a research order? What is the order? So that's what you have to write a summary for. And then you have order types. You have medication orders. Is it a medication order? Is it a plan of care order? Is it a discipline frequency change? Is it a supply manager entry or is it other? So what I wanted to bring about and show you is if you click on medication orders, you will be taken to the medication profile, and this whatever changes you make. For example, if you add a new drug, and then if you click on, if you don't have an order for it and if you needed to write a verbal order, if you click on this, whatever you put in here will populate in that section below. Okay, and so let me come off that. So then the other one is the plan of care orders. If you click on plan of care orders, all you got to do, see, it's not letting me because it's asking me to complete the rest of this information. But if you, I just wanted to quickly say that if you click on the plan of care orders, it will take you to the plan of care profile, where if you add an intervention, it will drop that data into this section. So let's just, to show you real quick, let me do the, and if I do plan of care orders, it says, okay, it's asking me to do a summary. So let's say research order, just for the demo purpose, and I'm going to go to the plan of care orders, and you see it takes me to the plan of care profile. So here, if I add any order, whatever order I add, it's a problem statement of is it comfort, is something different that's not already there. So for alteration in comfort, pain, whatever order you add, that it will take you from that to, and that particular verbiage will be dropped into the order. Let me cancel this for now. And the same with discipline frequency. If you click on discipline frequency, you'll be able to change the frequency. And the same for supply manager. The only other thing I wanted to specify is if it is other, what it means, if it will open up a box. See, if you click on other, it opens up a box, and I'm going to show you the box right here. So whatever you add here, just remember that it doesn't change anything in the plan of care profile. It will be only on this particular page. Okay, so that was about new orders. So then you have aid care plan that you can add from here. You can go and add a communication note from here. So if you notice from what I told you in the beginning, from the different tabs versus even from the chart, you've noticed that there are multiple points to document a single note. For example, if you want to, for example, add a communication note, I can do create new, and I can add a communication note, or I can go to this particular chart and click new and add a communication note. So it's not that there is only one way of approach to do a documentation of a particular thing. You have multiple points of entry is how we have designed it, because we want to make the software so easy to use that you're not constrained with only one way to do things. Okay, now let's go here. If you see here, you have schedule activity. Again, if you have permission to the schedule center, you will be able to see the schedule activity. And if you see a yellow sticky, it's a visit comment for that particular visit. If it's a blue sticky, it's an episode comment. If it is red, it's a missed or a returned visit comment. Okay, now having said that, I'm going to show you a visit note. Let's go to a skill visit note. Okay, I'm going to click on this. Okay, this is a skill visit note. Now you can see that this skill visit note has these risk stratification icons. Okay, and here you have the DNR. DNR is lighted up because in my Oasis I indicated this patient has DNR. Fall risk, hospitalization risk, and infection risks are also other trigger or other risk stratification icons that we have. So if our Oasis indicated, especially the start of care, if it indicated that the patient is a fall risk or has a risk for hospitalization or infection, then these will light up too. So this helps the nurse when she's, in her laptop or iPad, and she sees this patient, she is immediately warned that this patient has these risks, and that helps her with her care. Okay, on the top you also have view POC summary. So if you click on it, you will see the same plan of care summary, the one that I showed you a few minutes ago. which is your evolving plan of care, giving you a quick rundown of the latest interventions, latest change in frequency, or the latest change in medications. Okay, if I click on the view plan of care, so within this note I can access these things. View plan of care, if I click on the view plan of care, it takes me to the plan of care associated with this episode, and it gives me the details. So what I want to highlight is, when I'm clicking on the view plan of care, I will not be able to edit anything within this plan of care, because remember, it's only to view, it's not to edit, not to change. Okay, so I click close. So this way, while I am with the patient, after I have assessed the patient, and if I have a laptop or an iPad and I'm documenting in the patient's home, if I have a question about the plan of care, I don't need to come out of the screen to go and look for the plan of care. I have all of these within view at the same time. Okay, so here we have skill visit note. I can also change the code based on what kind of a note I am putting. Okay, and this last tab is to load the previous note. So in this case, so if I click on this, if I have the permission to copy or preload the previous notes, if I have that permission, then you will see this drop down of all the previous visits, and I could choose which one I want to preload. So for example, if I'm planning to preload this particular visit note, it gives you a warning saying, are you sure you want to load the SN visit note for this day by so and so person? And this will override most of the data in this form, meaning to say, if I have started documenting and then I decide to go ahead and preload another note, it will override most of the data. So, and right now I don't want to do that, so I'm going to cancel. Okay, so these were the different tabs on the top. Now talking about the visit note itself, so you can see the visit information is here, the travel time, the time in and out, associated mileage, and it gives you an place to put in if you know when the last visit of the physician was. The primary diagnosis, secondary diagnosis populates from the OASIS. Then you have your vital signs, and in the vital signs, what I wanted to show was under blood pressure, you see this here you have the left side. Okay, if I click on expand position, I can also view the right side and document. Similarly, let me pull this down a little bit here. Here you have additional measurements. Okay, you have additional measurements. So if you click on additional measurements, it gives you more information that you can document right there. So like your blood sugars, abdominal girth, A1C, INR levels, ankle circumference, or the calf circumference. Okay, once you add this information, make sure to save and close. You can also document if the physician was notified or the clinical manager was notified. Okay, the BMI gets calculated automatically, and you have all your other sections here to document, which is your neuro, respiratory, cardiovascular, GI, and so forth. The thing that I wanted to two things I wanted to show here mainly was the visit note. The way we have the way it is formatted here is you are documenting by exception, meaning to say if whatever is the abnormals is what you want to write here. So in this case, if I say no problems identified, then everything that's abnormal closes out. You see, there's a whole lot of abnormals that have been given that you could access and you could document. But when I say no problems identified, everything closes out. Okay, that's one thing I wanted to show. Second thing I wanted to show is anytime you see a colon, like see here, aphasia, and then you see a colon, that means there is something beyond that. So if I click on this and I'm saying this patient is aphasic, then it will open up and ask me to select all the different types of aphasia that's there. Like, is it expressive aphasia? Is it global? Is it receptive? So if I click on that, then I can also add more if I want to. Okay, now let's come out of that. So if I suppose I didn't add, then what happens? See, this validation box opens up saying a response is required, and this is tied to this colon here. So suppose I don't know the answer to that. For example, in this case, in this aphasia, I don't know what kind of aphasia the doctor has diagnosed to this patient. Then what I would want to do is don't check here, but instead go down to the comments and add it here. So that way you won't have the validation error pop up. Okay. So, and same is here, like you see here, oxygen use continuous. I have put 2 liters nasal cannula, but suppose it was intermittent and I checked, because there's a colon, it'll expect me to answer the other questions. And it won't let you complete till you add that. So if you don't have the complete information, but you do want to document, this would be one of the place where you would want to capture the information. Okay. Let me correct that. Okay. Okay, so going down, let's go down here. So you have your pain profile, you have your wound care worksheet. So in the wound care worksheet, if you click on this, you have the option. I'm going to expand this here. And this is not clickable. Okay, the wound man is not clickable. But if you go down, you can document the location and everything about this particular wound. So you have 5 sections or 5 places where you can document 5 wounds. And if there is more than 5, then you would want to put it under here, under treatment performed. You can add the others here so that there is a documentation of the other wounds that you have seen or noted. Okay, I'm going to exit that. Okay, let's go down. Okay, so these again, like we said, see, if no problems identified, that means there are abnormals, but I'm saying everything else is within normal limits. Okay, so before I go down, let me show you something real quick here. And that is infection control surveillance. Okay, so we are using universal precautions, but suppose I have talked to the doctor because I noted some signs and symptoms of a new, or I'm suspecting a new infection. I would want to click on this and add the information as to what is the infection I'm suspecting. Did I notify the physician or did I notify the clinical manager, and give more details about it. Okay, and here if a new infection was diagnosed, then this is the place to check that and add the details. Okay, let's go down. So you have here, if you see homebound status, we have given here homebound status and medical necessity within each skill visit note. So the homebound status here, let me pull that up a tad bit. The homebound status, you can see that you mark off, but the narrative populates from your OASIS. So whatever you put in your plan of care profile, that will pre-populate here. But remember that every skill visit note is to be individualized. So you ideally should be going into every homebound narrative and looking and seeing if that what is stated is true as of that particular day. Okay. So if you go down, I just want to show you real quick also that there is a medical necessity section too. And this section is also pre-populated from the OASIS. Again, medical necessity sometimes could change because, based on what's happening with the patient. So you would want to definitely go and check and see if this is applicable as of this time. So I'm going to correct this. It says as demonstrated by, but so and put this and save that. Okay, let's go to the one more section that I wanted to show you here. Okay, so here is your care coordination. So in the care coordination, see, I'm able to add an incident log. Okay, or if I wanted to add a new care coordination note, which is your communication note, if I click on this, I can add a new communication or a care coordination note. Okay, Next, let's go down here and I want to show you the, okay. So here we have review medication profile. Review medication profile, if I click on the review medication profile, it will take me to the medication profile. So this is your chance to review the med profile and, and teach the patient on whatever the new or changed meds. Okay. Down here we have interventions. So you want to write your billable skill for that day, but this particular day here, and you would want to write your response to that particular intervention here, and you want to write a narrative as to what else happened on this particular visit here. But I was going to point out that while you are doing your documentation of this skill visit note, you can also go to your plan of care profile. If I click on it, and this will give me the ability to mark the goals met or unmet if that is relevant at that point in time. For example, if this patient doesn't have falls, or this is toward the end of the cert and no falls, and or I have taught on any particular intervention and I want to resolve my goals, this is so you could actually do it while you're documenting your skill visit note. So we've made it so easy that you don't need to leave the screen in order to go to another place to resolve your goals. So for example here, if I click on this, you see it opens up to show me the need for fall prevention plan. That was my intervention. This is my goal. Okay, so I have 2-3 options that I can do. One is I can click here and resolve the goal saying goals met, because hey, this patient didn't have any falls or injury during this episode. I can do that. Or I can say it's unmet because of whatever reason. Or if I'm like, okay, I still have some more time, I don't want to resolve this at this time, but I do want to document that I did teach this patient about fall precaution. Okay, then all I got to do is click on this document, and whatever the verbiage that is seen here will drop into my intervention section. Okay, so since I have already documented on fall precautions in this particular visit, I'm going to go up here and document about the infection. So what I wanted to also show you was from the skill visit note, when you access the plan of care profile, all you're able to do is resolve the goals or document. You don't have the option to add anything new or to change anything that's already there. And the reason is because if you want to change any particular intervention, you should be having a new order. So you cannot go and change anything that's already created in the plan of care. Okay, so in this particular case, I don't want to go to hospitalization, but I do want to go to the high risk potential for infection. So when I click on this, you see it has 2 interventions. One about SN to assess for sign and symptoms of genitourinary infection, instruct caregiver on care of genitourinary system. And the other one that I have is to assess for sign and symptoms of infection and instruct on measures to prevent infection. So this is a general infection intervention. So I'm going to say, yes, I want to document about this. Okay, it says intervention has been added to your visit note. And I also want to say that the patient has been free of infection. So I'm going to click on document. So when you click on document, it says the goal has been added to the visit note. So remember that what is added is this exact verbiage that you see. So when it goes to your visit note, you will definitely want to go and make it to reflect as if the work has been done, because this is in the present tense, like SN to do this, SN to instruct, versus when you finish instructing, you want to say SN instructed on, and change the information that's given there. Okay, so I'm going to save and exit, and I'm going to show you that both of those things that I asked that it be documented has come into my section here. You see it says SN to assess for sign and symptoms of infection and instruct on measures to prevent infection, including this. I'm going to change the tense here to SN. Give me 1 second. I'm going to put this down here. SN assessed for sign and symptoms of infection and instructed on measures to prevent infection, including universal precaution and environmental sanitation. And if you go to the goals here, it's my goals. My goals here says patient will be free of infection. This is what was there. It says will be remain free of infection during the episode of care. So instead of saying will remain, I could say patient is free. Okay, so this is one of the latest cool features that we have implemented, or it's in right now available for the clients. Is you, by clicking on the word document within the plan of care profile, that particular verbiage falls into your intervention, but you should remember to correct the statement so that it reflects what you have done and not what you should do. Okay, so having said that, that particular section is the end of this skill visit note. The other things I wanted to point out here before we close the skill visit note is you have access to edit supply worksheet from here. You can perform a supervisory visit from here. It could be an LVN supervisory visit. It could be an aid supervisory visit. By clicking on this, you can access that screen. So like for example here. And here you can also add or edit the aid care plan. Okay, add or edit the aid care plan. So if you have a care plan that you already have, you can either edit it or you can even add a new one. Okay, so that is all regarding the skill visit note. Now here, once I sign this, I'm going to show you. Okay, so once I sign it, and I'm going to put the date for it was 20th and the time, let's say 4 p.m. So I'm completing my note, so I'm going to hit complete. Okay, and it moves that note to the QA center. Okay, see here, if you look at it, see it says skill nurse submitted pending co-signature. And the reason it says pending co-signature is because my permission said that for this, again, for the test scenario, my permission said that my note needed to be co-signed. Okay, now so if I go here to the my pending co-signature notes, let's go here, and I should see this visit here. Okay, because remember I could access it from my home tab. So here it is, Damien. I'm going to co-sign, and this is again for tests, this just for the test scenario. So I have the visit note here, and if I'm an RN and I have to co-sign, all I go to do is click on co-sign and co-sign this note. Okay, and the co-signature, I want to keep it for the 20th. Co-sign and approve, co-sign or exit. So let's go to co-sign because I want it to be in the QA center so I can show you the QA center. Okay, so its note has been successfully co-signed. Now I can access this particular note. Now where is this note sitting? The note is sitting in the QA center. Okay, see, and it's going to, if I have to look at what the status is within the chart, all I go to do is refresh the screen, and I can see that this note is sitting here, and it says, now you see the pending co-signature is gone. It says submitted with signature. What it means is it is submitted with signature for QA. Okay, so I'm going to QA from the home tab, and here I have the QA page. So here, if you see, I don't see any visit note. The reason is because it is not under agency main. So I'm going to click on all locations, and my visit is seen here because it is within that date range. So if the date range is off, you may want to correct the date range, by clicking on this and changing the date. So in this particular case, my visit was on the 20th. So I'm good because it is within that range. Here you have all tasks. So in this particular case, there's only this one task. You are under pending visits not returned. Okay. If you want to see what are the returned tasks, you could just click returned and you can see your list. So in this particular case, I want it as pending. Then you have refresh your list. Like any other page, if you click on refresh, it refreshes your list. And then you have, if the patient had, or if the agency has many AxxessCare visits, you would want to click on AxxessCare so that you can group all your AxxessCare visits and get that QA'd quickly. Again, you see your learn more button. So if you click on learn more, it will tell you information about this QA center. You can search a patient here by patient's name or the MRN number. You can search even by the different payer sources, payer types. Okay. And before I go to this section, let me show you here. So we also have it in like a little graph form here. It says pending 1. So that's one skilled node that is pending to be QA'd. And you see, look, it says here return 0. That means there is no visits or no notes that's been returned. So here again, I can look by patient, date, task, or clinician. I can check all, or I can specify being that I need all active charts, discharge patients, or non-admits. Okay, so here is Damian Bailey sitting, my patient that I just completed my visit note. And if I am a QA nurse, okay, and in this case, because I have all permissions granted for the testing purpose, I click on this skilled nurse visit and I have access to this particular chart. Actually this particular visit note. So now you see this particular visit note is here. So if I am a QA person, I have a print view of the visit note. So all I got to do is scroll through and read and check. But suppose I needed to edit this, or I needed to return this, or I could all I got to do is go to that particular button and that will take me to that screen. So in this case, suppose I see this an error in something. If I click return, I will be able to return this by writing my comments here and clicking on return. Okay, I can print this, I can close this, I can approve this, or I can edit this. So if I click on edit, I have the whole view in the same format as that of the clinician. And here, if the QA wants to edit something, this is the route to edit. Okay, let me close that. Let me reopen. So here, even while the QA is doing her QA, if she has a question, she can always view the plan of care right here, so that she doesn't have to go to the chart and open up another tab. Instead, right here she can pull this up as a PDF document and check the orders with the visit note. So we have made it that easy. The whole of Axxess, the whole software, as you see, ease of use is key in all our documentation. We are making it super simplified for the clinician so that they don't have to do multiple clicks, but with one or minimal clicks, I should say, you will be able to accomplish all your work. Okay. One other thing I wanted to show, and that's not related to skill visit note, but it's related to Oasis, and I'm just going to pull it back some because I have an Oasis already scheduled and waiting in QA that I know about. So here is again for the QA nurse, this is a recertification. So you see this, the name of the patient is in blue, and even the task or the note is also in blue. So if I click on the name of the patient, it will take me to the patient's chart. But if I click on the visit note, the blue link, it will take me to that particular visit note. Okay, so here in respect to Oasis, if it again permission based, you'll see this $sign and you see the percentage. So if you click on the $sign, it takes you to the case mix analysis. Again, not everyone has permissions to this, but if you have permission, you can see currently at this time, you can see what is the PPS, revenue based on PPS versus if the same information was given in PDGM, what will the revenue be? Okay, and then if you go down, you have all the different information that has been generated from the OSS. The other thing I wanted to show you is your gross margin calculator. Again, this is permission based, and if you have the permissions, you will be able to see the gross margin calculator along with the cost modeling as to how are you in a profit or are you in a loss. So this calculation shows you that you are in a profit in this particular scenario. Okay, just wanted to quickly touch on that. So if I click on the OSS link, I will be able to edit. I can check the scrubber, export the file, approve, return, print, or close. And here again, I can see the gross margin calculator. Okay, and now this concludes today's webinar. Thank you for attending.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.